Welcome back. You're watching Newslink on eNCA. My name is Annika Larsen and my co-anchor here is Taphuma Makina. While most South Africans are keen to get the jab, there's still some out there who remain skeptical. Well, legendary actor, writer and director John Kani is using his powerful influence as a role model to all of us to urge people to get the COVID-19 vaccination. I shouldn't have to read out Dr. Kani's CV to you, but a quick refresher. He starred in Black Panther, was the voice of Rafiki in The Lion King, wrote Kuneni in The King, is an apartheid activist. He wears his eye as a badge of his fight against apartheid. I could read the list of achievements all day long. I sound like such a lovey, Dr. Kani. I'm just praising you to the hills here. But thank you so much for coming on air.
Thank you very much. It is a very, very important issue. Africa has been part of the vaccination program since the 20s. It's almost like whenever there's a new vaccine, it's kind of like tested in Africa. You remember the polio, which was eradicated, whooping cough, diphtheria, measles. I mean, now we are so experienced in this process. So when I appeal to the elders, to artists, to young people, that this is, one more time, just an ordinary vaccine that will help us fight this pandemic. The results of not looking after oneself are obvious. Every day we read in the newspapers, we hear on television and on radio about 8,000 people infected just in the past 24 hours, over 100 people dying. There's something we can do. It's very simple, really, very, very simple. Wash your hands, put on a mask, keep your social distancing, get your vaccine. Especially the focus now is from the 60 and above. I went in, Annika, and there was a bit of a trepidation. I sat down, and then they spoke to me very gently.
Were you a bit nervous?
Yes, of course, you don't know. No. I am not a very good person of needles. No, and I know it's not going to hurt, but I'm always feeling like, what if it hurts? And she was talking to me. I was there with my wife, Mandy. She sat on the other chair. And I was also talking to Deborah Potter, who was telling me that her daughter is studying the island and would love to have a conversation with me. The sister is touching my arm with something cold, and I'm answering Deborah. And she says, "We're done, Dr. Kani." I said, "What? We've done." Deborah
Very
said,
brave.
As fast as that.
Very brave. This needle issue is a man thing. Women just sit down and get the jab. Why, Dr. Kani, are some people still reluctant to get their vaccination?
It has been so much sort of fake news, to borrow this from the ex-president of America, Donald Trump. Everything was fake, everything was fake. That resulted in the mindset of the people to question anything. Could be fake. You say it's the news, could be fake. You say a woman who had 10 children is missing, could be fake. You say a woman who was in the boot of a car hijacked, it could be fake. So we live in that world. So when it comes to the vaccine, the information we get directly from government, from the Department of Health, from our medical aid, those who are very fortunate, is accurate. There is a pandemic, we know that. We've seen, I buried my sister, I buried my son-in-law, I buried my cousin, I buried my best friend. I know this thing, so I know. So when I say to you, it is critical. Over 60, we go to 101, we can go there, but over 60, just a simple journey. It's absolutely, absolutely simple. They will never call you to sit there for 4 hours. You are called through the SMS when they know that within an hour, they'll be able to deal with you. So you sit down and you do this thing, and afterwards, you are told what to watch out, could be possible side effects. We must just stop this thing about what if it does. Somebody had this, what if it does? But the government could also help us by just giving us the exact information. When a crate of 1 million vaccines arrives and it's not yet approved by our medical sort of geniuses and scientists, don't say we have it. Please say you have it when you know it's going to be rolled out within a week's time, so that there is no, it's in, it's out, it's in, it's out, no, it's not have it yet, no, it's contaminated. That further confuses the situation. So it's important for me that the messaging is direct and from one source only. So and that messaging, I believe,
There needs to be better government messaging. And my condolences to you. I didn't realize that you'd lost so many loved ones. Really, I'm so sorry about that. I just wanted to change topics while I've got you on air, because it's a rare privilege. Charlene Surti Richards, she passed away last week, another national treasure gone. And sadly, she died without the financial dignity that she should have had after years of so much hard work. COVID has really hit our artistic community hard.
I was in London performing in the West End, Kunene and the King. We were to run for 6 months. At the end of the 3rd month in March, Boris Johnson declared all theatres, sports ground, galleries, museums, super spreaders. So we closed with Sir Anthony Shea. I got lucky to catch the final flight to come to South Africa. Now, what has happened since March 2020? Nothing.
Yeah.
Nothing. The artists have not been part of the major plan of what happens when the economy goes down. There is a master plan of how we will reboot the economy, how we will deal with the health, how we will deal with social services, how we will deal with unemployment. But there was no sort of structured mind. What are we going to do with the creative industries? So we find ourselves really struggling. People are talking about the residuals, royalties, and the bill lying in the president's desk or back to the parliament. I wish this could be fast-tracked so that the artists could also benefit.
I actually wanted to ask you about that as a quick last question, Doctor. Why don't our actors get the same lifelong royalties that stars in the US, for example, get, so that they don't have to work like Charlene did until they are really ill and tired and completely broke?
Charlene was a great lady, a grand master of her craft, an example, an inspirational human being who gave all in anything she did, even in an interview, on set, on stage. She was a marvel. She's one of those people that you, as an actor, you marveled, you know, without any kind of competition, jealousy. But the situation is that we're going through a new pandemic. We don't know. We did not prepare ourselves because we didn't know. So when we are working, we need to regularize or to regulate the arts industry. We need to structure the arts industry. It has to have an employer and an employee. It has to have UIF, pension fund, medical aid. It has to have those inbuilt things. I'm a member of the Screen Actors Guild in Hollywood. I constantly receive my royalties and residuals that have kept trickling in at this difficult time. South Africa has to step up. I asked for the South African Screen Actors Guild. We move in as fast as possible to talk to Minister Natim Teto and the Minister of Labor and the Minister of DTI, whatever, that cluster, to regulate the industry, to give us what we are deserved. Yeah. We've worked so hard. I'm 77 this year with a wonderful wife, 7 children and 9 grandchildren. Wow. What am I going to live on in another year's time if there are no proper structures that looks after people who've given so much into the economy of the country?
Thank you so much, John Kani there. Please, we need to protect our actors out there who are really the jewels in South Africa, who bring us so much stature and so much respect to this country. We really don't need them to suffer the way they are. Thank you.